I will, without any further ado, I'm going to hand over to each of the speakers to actually introduce themselves. But I do want to firstly introduce Dr. Toby Fattore from from Macquarie University, who is our first speaker. Thanks, Toby.
Thanks, Neil, and also thanks, Glenn and Men's Health Connect for the opportunity to speak today. Now, I'll share my screen, and whilst I'm doing that, I also want to acknowledge the traditional custodians of the land where I am, which is in Marrickville. That's the Gadigal people of the Eora Nation, and also extend my respects to Elders past, present and emerging, and any other Aboriginal, Torres Strait Islander, First Nations people who might be joining us today. Okay, so here we go. Now, look, I have been asked today to essentially provide a little bit of context. It's not specifically on boys' health, but on children's perspectives of understanding health in relation to their well-being. And so this is research that I've undertaken with Professor Jan Mason, who is from Western Sydney University. And essentially, hopefully, we can provide us a child-centred perspective and also a little bit of context around some of the issues around children's health, which may be helpful for the other speakers as well. So where I want to start is by discussing how children's health has been a kind of a topic or a site for establishing normative expectations as to what constitutes appropriate parenting and also childhood behaviours. And often health and well-being, they're conflated. So children's health is often the site of social anxieties, especially regarding the health of populations in general. So in this presentation, I want to explore children's understandings of health in relation to these particular anxieties. So I'll examine what children consider to be most important to their health based on a qualitative study of what children tell us about their understandings of well-being, which was undertaken in New South Wales, Australia, as part of a multinational study on children's well-being. And I want to place these perspectives in the context of what I've called discourses of healthism regarding children's health, to serve as a counterpoint to how children discuss health and how this relates to their sense of well-being. Okay, so the emergence of, and this is probably familiar territory for most of you, the emergence of biomedical sciences, of epidemiology and developmental psychology in the late 18th and 19th centuries emphasised conditions under which children not only survive, but also flourish. So the expanded use of medical technologies, advances in public health, meant that maternal and infant survival in many parts of the world, but not all parts of the world, was no longer the baseline for child well-being. The expectations were beyond that. So in the late 20th and early 21st centuries, because of this, we've also seen a shift in the character of these practices, and also with increasing importance of what Crawford described as healthism. And Crawford defines healthism as the preoccupation with personal health as a primary focus for the definition and achievement of well-being. Now, the term was initially used to describe holistic health and self-care movements. However, these tenets of healthism, which I'll talk about throughout this presentation, have become more generalised in a preoccupation with things like lifestyle practices and healthy lifestyle practices. So healthism promotes a kind of a less medicalised concept of health and biomedical sciences, but etiological factors beyond individual behaviours don't really feature prominently within healthism. Rather, individuals are seen as responsible for maintaining their health through things like exercising the right kind of choices over whatever, like an increasingly large number of health options. So health outcomes are linked to individual choices, and poor health then is a result of either inadequate knowledge or irresponsible health behaviours within this particular way of seeing health. So it's in this context that several critics have illustrated that much of a discussion regarding children's health taps into deep sources of parental anxiety and concern about children and children's health. And often poor child health is posed as a failure of parental responsibility. So health policy and healthy lifestyle campaigns that evoke very powerful notions of obligation regarding children's health. This can be evident in a whole range of things, like whether children are eating the right foods, whether they're exercising enough, and so on. So the normative framing of these issues also illustrates concerns about the future, as well as concern for children in the everyday, like present children, actual children. You know, so for example, when you look at World Health Organization documents around childhood obesity, it's very much posed in terms of not only concerns about children now, but also in terms of the long-term health outcomes for the future adult population. The other aspect of healthism, which is important to emphasize, and I'll go on to explaining the reasons why, because these come up as themes in children's discussions as well, is that there's a particular understanding of the relationship between the body and health. So because healthism emphasizes physical activity as one of the main predictors of health, certain body shapes, weights, and sizes are seen as denoting an individual's attitudes towards health as well. So you would think, because healthism emphasizes individual responsibility for health, it could be argued that a logical implication of this is that children are seen as quite active, that they're actors over their health choices. But usually the kind of way that children's agency is framed is in terms of, say, pest to power, or kind of being resistant to kind of healthy practices. And actually really what healthism really promotes is that children should be the subject of health knowledge, and they're acted upon through the daily practices, which are largely determined by, say, parents and educators. So children in this understanding only have very limited understanding of health, and can therefore contribute in a very limited way to decision-making about their health practices. So, you know, on this basis, and I'm trying to set up, I suppose, a problem here, we can identify several tenets of healthism that are worth investigating from children's perspectives, and these include those three that I've listed there. That health is an outcome of rational decisions, and therefore health outcomes can be associated with individual choices. Now, within market economies like ours, this essentially means that health is reliant upon individual choices within the market. Further, that parenting practices are the primary determinant of children's health, and parents are not necessarily children who are the rational subjects around health decisions. And thirdly, that there's a particular view of bodies as signifiers of health, and in particular the slim and strong body as a healthy body. So are these tenets evident in the way that children discuss health? Are children's priorities when discussing health similar to those within healthism discourses? Okay, so let's have a look at some of, I'll go into the methodology that we use and then go into some of the findings. So as I said, the research that I'm about to present draws on a study on children's understandings of well-being. We didn't actually ask specific questions about health. So all of the health-related topics emerged spontaneously from the children's discussions as aspects which are important to their well-being. And I'll get back to that later. So there was 126 children aged between 18 and 15 years, and it was a qualitative study. So that's quite a large number of participants for a qualitative study, and it was undertaken over 3 stages. So in the first stage, we explored children's ideas about what well-being means to them, how well-being is experienced in the course of everyday life, and what factors contribute to a sense of well-being. So then in the second stage, we interrogated individual transcripts. Now at all stages, the research could be done either as an individual or as a group, so that and usually peer groups with friends, and that was determined by the children. Okay, so the second stage involved us interrogating the transcript of the initial interview, and then going back to the children and asking them specifically about to tell us a little bit more about the themes that they raised in the first interview. And what that allowed us to do is to get a little bit more depth from children about their experiences and for them to clarify our interpretations. So we added to the analysis. And in the third stage, we got them to do a wellbeing project. And that was on a topic of their choice in a medium that they chose. So collage, photography, video making, keeping diaries or journals, anything. But then that became the basis of the interview later on. So we had children from both rural and urban locations, quite a significant proportion of children from areas characterised by high levels of socioeconomic disadvantage, and approximately 40% of the participants were boys. Okay. So let's go into the findings. Okay. Now, the first finding is that eating was a major theme in children's discussions regarding their well-being. That's probably not a surprise to most of you. But what was of significance to children when discussing food was that they described food as a facilitator, right? As important in undertaking the daily activities of being a child. So food was fuel, and many children made references to energy. So in this first quote, Prudence explicitly links functioning with energy, and one precondition of that is healthy eating. So like if you don't have energy, you can't do running or horse riding and stuff, she says there. Now, this aspect of the functional aspects or the facilitating aspects of food also included identity work associated with presentations of the self and the acceptable body. So for nearly 10, by the way, these are all pseudonyms chosen by the participants themselves, for themselves. So for nearly 10, not having a healthy body can mark you out for ridicule, right? So, when nearly 10 says things, I don't know, sometimes you feel like you don't feel well because you get teased around and all that. And when asked to explain this further, nearly 10's response indicates that the healthy body is important to children in terms of sociability, because sometimes they judge you about your looks, and if you're fat, then I don't know if anybody will be your friend. Okay. So nearly 10 relates being overweight with the affective aspects of health, and that's linked with acceptance by others and self-acceptance. So the complex affective aspects associated with eating are also evident in children's discussions about eating being associated with self-care. And this involved a range of experiences, including comfort, reflection, escape, a sense of managing anxiety, and also feeling normal. So in this quote here, the participant is discussing a bodily and cognitive experience of what we could describe as ontological security, of belonging to the world by being present through the experience of eating. Like sometimes you're all worried about stuff and everything, and when you eat, you're concentrating on that, and you just forget about everything else, and makes things seem normal and everything. So this sense of ontological security is critical in being able to engage in social practices with their attendant risks and hazards. To feel like you can move in the world with a sense of kind of trust in the world, which may have actually been damaged by the current the circumstances around COVID-19. And so these are benefits that typically go beyond those typically emphasised when we think about good nutrition, and which are emphasised in Healthism. So I want to move on to another theme, and that's about physical activities and doing health. And this is the most recurrent theme in our study in children's discussions of health, and that's the active body. So for children in our research, the healthy body was an active body. And this was demonstrated a lot when children discussed physical activities. So children valued physical activities when they made it possible for essentially freedom from things like organised time, including school time and family time. But what was interesting about this is that physical activity per se was not associated with well-being. It was the activities that were facilitated through physical activity that were associated with well-being. So for example, Apex in this quote discusses a state of general well-being. So Apex says, he says, causal health is like, helps you adjust your mind to something. You can focus and concentrate on what you're doing. You don't have to worry about it much. And then later on he says, You've got friends and relationships with family, and there is a physical sort of health, which is exercise and food. They are all interrelated. They all go together. So the food comes back to health. Like I said before, it's all interconnected. So if you don't exercise, go out, you don't make friends. If you're not making friends, you're bored. Now, so here again, this aspect of sociability and the kind of functional aspects of physical activity are really emphasized. So the discussion of physical activities as part of routine social interactions with other children is quite different from how health education campaigns often attempt to promote exercise as something that an individual should make time for. These types of discussions might be typical of ways that many adults talk about the need to do more exercise. But what is evident in children's discussions is that exercise often occurs spontaneously and is part of other activities like, social interactions, time with friends. So it's part of it's a consequence of everyday life. It's those everyday practices, rather than something that's made time for. Okay, so I want to compare the kind of the healthism discourses and what we found in our study about what children emphasised in terms of health and their sense of well-being, right? So children in our research view health, I suppose, in some ways in quite different ways than suggested in healthism discourses, and we can discern 4 key areas of difference. The relationship between health and well-being, how children's agency is understood, responsibility for health, and what are the kind of the social sites of health practice, and how the healthy body is conceptualized. So I want to briefly touch upon each of these points in turn. So firstly, the health and well-being nexus. So earlier in the presentation, I discussed how healthism discourses tend to reduce well-being to a set of values that promote healthy living. However, children's discussion of health reverses this relationship, with health as one dimension of a broader experience of well-being. And more specifically, health practices were especially important to children when those practices were associated with a sense of feeling safe, of experiencing a positive sense of self, and also being able to express agency and have agency. And this leads us to our second point of comparison, and that's children as health agents. Now, as I said earlier, healthism discourses attribute quite limited agency to children. And we see from children's discussions that agency is expressed in various health-related behaviours. In fact, when children discuss food as a facilitator of a body in motion and of a sense of well-being through positive sensory experiences, they are acting out their agency through various health-related practices. So these expressions of agency are not so much about asserting choice in the market over your health, and that which is associated with what we might consider a rational, liberal kind of agent or subject, but really are about agency which is embedded in daily practices and often taken for granted for children. So it's kind of more situated in everyday life. Now, thirdly, responsibility and the size of health practice. So as noted earlier, healthism discourses perpetuate this ideology of the responsible parent, including parents having responsibility for their children's health as future adults. So therefore, how adults exercise choice in sort of a market for goods or other healthcare is of particular importance within healthism discourses for the health of children now and also the next generation of adults. But in our study, we found that children also prioritised present experiences as important to their sense of well-being. So much of what children associated with health were immediately identifiable signs of healthy appearance, including physical, emotional, and psychological signs, and importantly, the functional outcomes of healthy practices, such as being able to focus or engage in physical activities competently. And I think this then leads us to the kind of a final point of comparison between the two, and that's the healthy body. So within healthism discourses, bodies are considered, as I said before, in very normative ways. So with a body shape and size signifying not only dimensions of their health practices, but also their attitudes towards health. In children's discussions of health, but this they also emphasize this connection between, say, eating the right foods and exercising, and also desirable or undesirable body types. And they talked about some of the implications of that, especially in terms of kind of their social. But what was more often emphasized was the body's functional capacity, right? The body being able to do things, and a range of things, a diverse range of things. But it was often very sensory, and it was often associated with fun and leisure, right? So we can see some significant differences there. So this is where I want to conclude. I think I've got a minute left. I think I should be coming within time in. So discursive or representational social forces, like, for example, our attitudes to health or healthism within the kind of the public sphere and in popular media, they are one component and an important component for which children understand and experience their health. However, while some elements of children's discussions of their health are actually quite similar to these healthism discourses, which shape many of our attitudes, other elements are very different, and their attitudes are very different. So, and that's probably similar with adults as well. But in part, the reasons for this is that healthism is a limited discourse. And it can be understood because it promotes a notion of self-responsibility as a moral practice. And this notion can often alienate individuals. We need to constantly take responsibility for one's behaviour, a drive towards self-improvement, the emphasis on individual choice, and that poor health as a consequence of individual failings can often leave little room for practices associated with pleasure, fun, and a sense of well-being. And that's where I'll leave it. Thank you.
Thanks so much, Toby. That was a really amazing condensation of all that great research into some really focused points in relation to children's views on health and well-being. Thanks very much. I was particularly enthusiastic about the sort of seeing the notions of health and well-being as of equal value from a child's point of view. We do have time for a couple of questions. There's nothing in the chat box, but has anybody got something they'd like to pose to Toby? Doesn't look that way at this point.
Peter, Are you asking a question? I think you have to unmute yourself. Yeah.
Oh, Peter.
Hi. Look, I was only going to just say, what would be your take-home message for people working with young people in terms of their health, men's health sphere, whether it's boys or girls? What would you say is your take-home message?
Yeah, look, I would say that in terms of promoting health practices, rather than being didactic, try and build those health practices within things that your client group would be doing in everyday life. So, so make it fun, whether it's part of leisure practices. So not just be another kind of work or adult that's kind of imposing another set of criteria. Because I mean, that was really the big thing that came out, was that it was almost like these health practices were incidental and part of every other everyday activities. Yeah, that's probably the takeaway. Thanks for the question, Peter.
Any other questions at this stage?
Toby, if I can ask a question myself. Were there any findings related to the relationships and friendships? I mean, in terms of the sense of, belonging to the friendship group?
Yes. Yeah, look, that was an aspect which I didn't necessarily really focus on today. But in terms of well-being, friendships were quite critical, and there was this distinction between friendships which were kind of just part of your social relationships, a kind of a way to do stuff important to well-being. And those friends that you trusted intimately, right? And so having kind of both sets of friends was important to a sense of well-being. In regards to health, I would say friendship groups are kind of one platform to facilitate healthy practices. You know, if it's fun, doing stuff together through kinds of social interactions, which can make, for example, you know, talking about health, sharing health ideas, and also, you know, sort of being perhaps physically active. That's a really important forum, and probably much more influential as children get older than, say, parents and teachers. Thanks, Siobhan.
Thank you.
Thanks, Toby. There's a question in the chat box from NWA. Whether, and I understand that you were talking in generalities here, but was there anything that came out, particularly in relation to cultural and religious backgrounds?
Yeah, look, I mean, so 40% of our sample involved children from culturally and linguistically diverse backgrounds. And again, like, because our study was on well-being, one of the factors that really came up, which was really important, I think this is probably maybe especially important for young men, was this notion of identity. And often forms of group identity and affiliation was something quite important for well-being, especially where it provided children with a sense of moral agency. Like there were aspects of their life which they could see was linked to some higher ideal or set of principles, and often group identity around, say, cultural and ethnic practices, which were kind of lived out and kind of it reinvented. That was often talked about as associated with well-being. And I suppose that's probably really important for mental health, I would say. It's a good question.
All right, thanks, Toby. And thanks so much for all your questions. We do have another question from Chris. We might need to make that the last one for now.
Yeah, we have a question from Chris asking any mention of spirituality / meaning coming through in these conversations about well-being.
Yes, it certainly was. And certainly I think spirituality, I think we came through in a number of ways. For some children, it was raised as important in terms of their participation in institutional religious practices. So often, you know, going to church for many of the children. I'm not sure if it was like children. Yeah, so really participation in formal religious activities is often associated with well-being experiences. So that was one aspect. Another aspect of spiritual practices was often came through when children talked about wanting to pursue things associated with justice. So things like climate change, dealing with inequities that they saw around them, rather than necessarily being seen as something which was too large for them to deal with, when associated with a sense of well-being, was often kind of reframed in terms of a kind of spiritual agency, right? A kind of a drive or a project or an ambition. Which is more of a kind of how could I put it? More of an atheistic spirituality. So we saw both of those elements, and again, this may have some importance for mental health outcomes, but because it's a qualitative study, we couldn't really test that. But great question. Thank you, Chris.